The false chord to me is conceptually the hardest structure to understand, because for me, and there have been various ways to look at it, but from, if you will, a simplistic approach, for me the false vocal cord is the inferior reflection of the aryepiglottic fold. So if the aryepiglottic fold goes from the epiglottis down to the arytenoid cartilage, where the false vocal cord turns on itself is right at the false vocal cord, which attaches to the arytenoid cartilage. So here's a schematic illustration demonstrating the false vocal cord. Just below it is this little air-containing structure right here, which is the laryngeal ventricle, and just below that we'll see is the true vocal cord. So on cross-sectional imaging on CT, how do we determine that we're at the level of the false vocal cord? The key thing is that when we look at the larynx, and this is what I use, and I'm sure others have their own way of identifying it, but when I look at CT scan and I see just the tip of the arytenoid cartilage, then I know I'm at the false vocal cord. If I see this tissue here and I see no cartilage, then I'm above it, I'm at the aryepiglottic fold. But as I extend lower and lower and lower, and I just see just the tip of the arytenoid cartilage, that tells me I'm at the false vocal cord. So just below the false vocal cord, as I mentioned before, is the laryngeal ventricle, as is seen here, and below the laryngeal ventricle, we come to this level, which is the true cord.